Hi, guys. This is Dr. Lori here, and it's been a while. I'm here with another episode of Anti Aging Unraveled. And it's a great time to start thinking about getting your skin ready for the summer. And I have been asked quite a bunch of times lately about what ingredients are actually useful, what works to put on your skin. There's a lot of myths out there, there's a lot of everything, we look at everything differently when we turn 40. I say everything is fun and games with skincare until you start seeing wrinkles and dry skin and dark spots, usually around 40 years old. And, that's when it's time to get serious about skincare. And, when we're younger, we think about pretty packaging or scents or what feels good. And I think it's time that we start talking about what's scientifically proven. So this podcast is gonna tell you what science-based skincare products are out there, and I'm not gonna give brands necessarily. I think you should be an ingredient reader in general. Again, we're not looking for pretty packaging or scents and texture. Maybe it's a little bit of texture, but we're looking for active ingredients. So it can be a little overwhelming. And the words, we see these words like amino peptides and biorestorative, and they all sound wonderfully impressive. But really, there's only a few things out there that are what we would call scientifically proven to help. So I'm going to go through what I call the 10 things that are scientifically proven to improve skin texture, tone, collagen, tightness, and to protect your skin as well. So I'm going to tell you the 10, so you don't have to listen to the whole entire podcast, but please listen to each one. I'm going to give you a brief little synopsis of why it's important. But the first one that makes the top of our list is hyaluronic acid. And then two would be what we call collagen peptides or growth factor creams. Three is your retinols or your retin A products. Four is vitamin C. Five is your sunblock with zinc and titanium dioxide. And six is ceramides. Seven is lightening products. We're going to go through a little bit of the prescription and the plant lighteners. And then mild acids such as glycolic, salicylic, and alpha hydroxy. And the last two are more for maintenance, water, 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 and more water. And 10 is cleanse, tone, and exfoliate. And to me, the reason why that's 10 is yes, it's important to clean your skin. Yes, it's important to tone and prep the pH of the skin to accept ingredients on top of it and to take dead skin off. But they're just to help maintain your skin and not necessarily create an anti-aging process. Um, so the first one, hyaluronic acid, should be used twice a day and it fights your fine lines and wrinkles. This is going to be a naturally occurring product that actually is meant to draw water into the skin. So it's going to do the job of hydrating your skin and helping with fine lines and wrinkles. And that's really important because it's ultimately going to support the structure of the skin, which weakens with age. So there's tons of hyaluronic acid products out there. I do encourage you to look for pharmaceutical grade hyaluronic acid products. It is you do get what you pay for with hyaluronic acid. The over the counter or a pharmacy brand generally don't have a high quality or a lot of hyaluronic acid in them. Two is collagen peptides and growth factor stimulators. This to me is one of the best things that's been created over the last probably 10 years or so. And they help with elasticity and strength of the skin as well. So they're going to give you some structure and they're going to actually help with like sagging skin or elasticity. It also increases the water content of the skin, but it'll help with a youthful look because it'll give you a much smoother complexion. Okay. I get the question all the time about collagen peptides orally, and there is some data to show that they increase skin elasticity and hydration and density, but there's very limited studies on it. And the question really remains is how well is it absorbed and how do you direct that to the skin and not to your joints and other places that need the collagen repair. So yes, I think collagen peptides are good to take. If you're looking for a way to possibly cut money, I don't know if the collagen, with hair and nails, I can say there's a lot of good data, even with joints, but on skin, it's not as impressive for the oral. Three, retinols. So retinols, retin-A's, they have been around forever. We know that retin-A's or retinols, they're a vitamin A derivative, and they're actually going to help to increase the amount of hyaluronic acid in your skin. So it will actually help to produce hyaluronic acid and fight fine lines and wrinkles. I always say it's the slow boat. because it slowly exfoliates, takes the dead skin cells off, helps them to come up what I call the skin escalator, up from the bottom up to the top and shed off to help reduce the fine lines. So overall, creating a smoother skin texture. Studies have also shown that retinol stimulates blood vessel growth, so it'll help to target uneven skin tone and darkness. So, we do see retinols combined a lot of the time with other products, and it's because they help with penetration, they help with and vascular supply. And for dark spots, they actually help it to penetrate. All right, number 4, vitamin C. So vitamin C is what I would call the antioxidant guy. It is needed for the synthesis of collagen, actually. Vitamin C is a prerequisite. So it helps us to make collagen in the long run, and it's a great antioxidant. So it's going to neutralize all the things that UV rays do, basically. It's going to neutralize those, what we call free oxygen radicals, which is really just negatively charged particles that actually cause our skin damage, and it's going to help with the elasticity and discoloration. So there are skin sample studies that showed that vitamin C implied daily improved thickness and increased collagen production. There's also studies that have shown vitamin C can help with pigmentation and be protective, and then it actually limits the free oxygen radicals from the UV rays, like we said. So there is data to support vitamin C. Eating vitamin C is very good for your skin as well. So I'm a big believer in the gut is a reflection, or your skin is a reflection of your gut health, and actually vice versa. So eating vitamin C and having tons of antioxidant rich foods will also help with the skin texture. Probably one of the most important things on here is sunblock. Sunblock, we know that anything over SPF of 30 is really minute degrees of extra protection. So I'm not saying necessarily you have to look for like a 60. And I have a whole sunblock lecture. If you guys go back through my podcast, there is one on sun protection and the differences in sunblocks and sunscreens. But we're looking for a sunblock. Why? Laying out and baking in the sun is going to create damage no matter how much sunblock you use. The sun creates oxidative stress. Again, we kind of talked a little bit about those little negatively charged particles that are going to cause damage from in the UV light. And then you're going to lose elastic tissue. You're going to get color differences. You're going to get fine lines and wrinkles. However, a hat SPF of 30 plus and making sure that SPF, in addition to or on top of, has zinc and titanium dioxide to actually block the sun. They're considered what we would call physical blockers or what we would call mineral blockers, and they actually will reflect all of the light from the sun off of your skin. So, you need to protect that delicate skin, that's our largest organ, from the UV rays. And the only way to do that is to actually limit its exposure. And there are plenty of studies, but there's a sunblock study of 903 adults that were found to have a 24% decrease in aging compared to those that were unprotected. And after 4.5 years, very little to no detectable skin aging as opposed to the group that did not sun protect. So this is something that we preach a lot, but it is very important, even on the days where it's cloudy and gray or you're driving, to sun protect. A very popular one, which is number 6, is your ceramides. And ceramides really are what I call like the moisture and lipid holders. They're gonna protect your skin. And I like to think of ceramides as almost like a barrier. These fats and skin cells decline with age, and there are tons of foods that can help with ceramides. So you can look up a ceramide specific diet. And we're looking for plants, plant derived. So rice bran, shea butter, retinols all actually contain ceramides that are great for your skin. So I like to say that they're kind of a moisture or a skin protectant. So they were going to help with skin texture usually and kind of glow. It gives you kind of that softness to your skin that has like a nice shimmer. I always like to say it gives you the photo effect. So when you take a picture, it just looks nice and smooth without the filter. Number 7, lightening products. Tons of these out there, and actually they get a little bit of a bad rap at times, but their purpose is to reduce what we call photo aging, so sunspots, melasma, which is other darkness from hormone usually related changes, and even acne or other type of scarring that's dark. And they all work by a similar mechanism to reduce melanin, which is produced by the skin, which is your pigment. And most people who use lighteners, they're trying to treat the problems that I talked about up above, and they start with what we would consider plant-based lighteners. And they're licorice root, mulberry, resveratrol, which is red wine extract. And some of the more popular arbutin is from cranberries. It's ARBUTIN, and blueberries, and it breaks into what we call glucose and hydroquinone. Hydroquinone is a bleaching agent we're going to talk about, but for sensitive skin, arbutin is great because it's not quite as aggressive as the hydroquinone by itself. Then there's azelaic acid. Azelaic acid reduces inflammation, decreases rosacea. It's great for killing acne bacteria and reducing the breakouts and thus the dark spots and redness. Um, so azelaic acid you will see combined with a lot of these prescription or plant lighteners as an anti-inflammatory. Then there is niacinamide, niacinamine rather. Um, It is for free oxygen radicals. So it is going to fight acne and convert into two enzymes that give skin energy to repair itself. So it's what we would call a kind of like an antioxidant. It's going to create a reparative structure. So it's improving tone and texture. And it doesn't necessarily directly get brown spots away, but it will help to smooth out the skin as you're repairing. Um, Let's see, Kojic acid. Kojic acid is a great one, actually. It's from the fermentation of fungi, various fungi, and it actually directly inhibits melanin production. So it will stop the ability or halt it, if you will, of the skin cells to produce more melanin. So it will help to reduce them over time, the color over time. And then last but not least, hydroquinone. And hydroquinone is directly interferes with cells' ability to produce melanin. So it is a little on the stronger side as far as lightening creams go. Usually they go anywhere from 2 to 8%. And we actually offer a lightening pad, which has the plant lighteners and the hydroquinone can be added in, which I love because you can get chest, shoulders, back, everywhere with one wipe, as opposed to using a cream everywhere, which can be messy and you can go through a lot of product. So and that actually is one of our new products on our website. But the hydroquinone is wonderful. And like I said, you can go up in percentage, especially if you're not doing well at the lower percentages or if the arbutin isn't enough for you. All right, number 8, mild acids. I love my glycolic acids, but there's glycolic acid, there's salicylic acid, there's beta hydroxy acid, and they all help speed up skin turnover. They're going to dissolve the bonds that hold the skins together, and you're going to be able to shed the dead skin cells more quickly. So the increased turnover will actually take off a lot of the color just as a byproduct of shedding. Um, but it's also going to trigger collagen production, especially glycolic. Glycolic acid specifically triggers collagen production. And so you're going to get a nice, firmer appearance in addition to getting rid of some of your spots, which the acids do. They're also great for getting rid of the acne bacteria and shedding the skin so that your skin cells can open up so that we can get rid of the active acne. And then there's water. So water, 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 water. We really want to hydrate from the inside out, guys. Dietary water can increase skin hydration, in particular the outermost layer, which is the most visible layer, and make you not appear as dry. And not being dry will make your skin more supple. Being more supple means it's tighter and it's not as lax. And that is really important when we're aging. We want to make sure we give it every opportunity to stay as plump as possible. And the other benefit to drinking a ton of water is the weight loss component and obviously managing hunger. So, the more water, the better. I always say your weight in kilograms in water is probably a good way to go. But, if you can carry your water around at all times and just try to make sure that you're staying hydrated, that is going to absolutely help you in the long run. And then everybody wants to know, special cleansers, exfoliators, toners. This is number 10. And for me, unless you're using it for acne, unless you're using it for the glycolic acid part of it, where you're trying to like slowly exfoliate, or salicylic acid, you don't need any type of what I would call fancy cleansers. Again, unless you're using it to do a purpose like exfoliate, which you can do that with for acne or for brown spots if we're using, or we're doing a mild glycolic once or twice a week. The exfoliation part as well, I love a good weekly exfoliator with a gentle scrub, which again, we do have a really fine micro scrub which is wonderful. But as far as anti-aging goes, all it's doing is getting the dead skin cells off and allowing the other products to get in effectively. And it's going to help with pore and texture and size of your pores, but it's not going to necessarily reverse aging specifically. It is going to prevent the pores from getting filled with sebum and opening up and actually making your pores wider. Which, when your pores are clogged and you're not washing your face before bed, you can see the pores start to increase in size, especially with increased oil production. And then toner. I would say not everybody needs a toner, but toners are more to even out the pH of the skin so that it does not get affected, or sorry, that it accepts the other materials that you're putting on it more easily. So it helps you to not be as dried out from products. It helps your skin oils to not be on there when you're putting other creams and serums on there. So it's really just a pH balancer. And especially for acne prone skin, toners are great because it's going to reset the pH before you're putting other things on your skin. And it can help to kill some different acne bacteria that are going to be sitting there that you maybe didn't cleanse off as well. So usually they're what we call witch hazel based and have a little bit of alcohol component to them. So they can be a little drying, but even if it's a couple of times a week, toners are a great adjunct, but I wouldn't say necessarily for everybody. So if you guys want to look up some of these products, I do. We have 2 websites that you can get a lot of these from. They refresh wellness.net. The glycolic products that we just launched are not on there yet, but you can call the office to get those. 215-968-3057. We have a glycolic scrub and a glycolic cream, which is amazing. We also have a new salicylic acid spot treatment for acne, which is wonderful. And on mydrlori.com, which is mydrlori.com, you can get we have the spot wipes. I have a great retinol. I have a wonderful exfoliating wash, an acne kit that's fabulous. So feel free to check that out. We also have a collagen peptide cream, which is our growth factor cream. And we have, what else did I go through today? We have the scrub too, the microfine scrub, and retinol pads, which are wonderful too. So on that note, guys, if you're not thinking about skincare over 40, you should be thinking about skincare over 40. And you really should be thinking about preventative skincare before 40. So look for these ingredients, ask me questions. Feel free to email me directly from the website or hit me up on social media if you have any questions. And I will talk to you guys soon because my dogs are about to bark. So I'm going to sign off and I will talk to you guys later. And until the next Anti-Aging Unraveled.